Now, the first pill designed to treat COVID has been approved by the UK medicines regulator. The tablet will be given twice a day to vulnerable patients. It was recently diagnosed with the disease. Let's get more with our health correspondent, Catherine da Costa. Health Secretary has described this as a game changer, and all the indications are that it will be.
Yeah, this is really good news, particularly for vulnerable groups, so the elderly and people with a weakened immune system who may not respond well to COVID vaccines. Now, before, we had treatments that were given in hospital to patients that were seriously ill. This is the first drug that can be given as a pill at home in the early stages of an infection. Clinical trials found that the tablet molnupiravir halved the risk of hospitalisation and death in at-risk patients. Now, patients will be given a tablet twice a day, and the treatment works by stopping the virus making copies of itself. So reducing the levels of the virus in the body reduces the severity of the disease.
Somebody described it as mutating itself to death, which I thought was quite a good description.
So today, the UK regulator, the MHRA, approved it, saying it's safe and effective, and it should be given as soon as possible after getting a positive COVID test or within 5 days of symptoms starting, and it will be given to people with mild to moderate COVID with at least one risk factor. So that could be obesity, heart disease, diabetes and older age.
So I think we've ordered, what, 500,000 or more? When will they be dispensed?
Yeah, so the US drug company behind this thinks that it can produce about 10 million courses of this drug by the end of the year. As you say, the UK government has pre-ordered nearly 500,000 courses. We don't know how much it's paying for that. The US has ordered about 1.7 million and is paying about £500 per course. The UK government's in talks with the NHS to see how quickly it can roll it out to patients, and this will be done through a national study as soon as possible. We're not given exact details of the timescale yet, and there are still some questions about the logistics of how it will be made accessible. It is worth pointing out that this isn't an alternative to vaccination. People are still urged to get their vaccines, their boosters, their flu jabs. But this is hugely important because no vaccine is 100% effective. Some people can't have vaccines or don't respond well to them. So this is another weapon in the fight against COVID, and it's helping reduce, those most at risk from, serious illness, reducing hospital admissions and therefore ultimately pressure on the NHS.
OK, Catherine, thanks very much indeed.